I love the podcast you're doing and everyone you're bringing on. So I had to find some time to free up myself.
Thank you so much. Thank you. Extraordinary figure in the world of ophthalmology, Dr. Ahmed Shabana. With over 15 years of impeccable service and groundbreaking contributions in eye care, Dr. Shabana has truly set a new gold standard in the field.
Dubai, very cosmopolitan city that we live in. We see a lot of people that have problems related to the use of screens and laptops and mobile phones. Everyone is on it day in, day out. Actually, there's a lot of allergies, whether acute cases or chronic cases.
It's very common. And we don't notice this, and even teachers, they don't notice there's so many kids.
Refractive errors or myopia, which is short-sighted, is actually growing exponentially around the world.
What are the ways where you can protect the eye health of a kid?
For good health of your eye, especially in front of screens, every 20 minutes, take a break for 20 seconds and look at any object at 20 feet away.
Does this blue filter, the different kind of filters available in gadgets to compensate that, you can use the screen as much as time possible, does that really work? These filters?
Lovely question.
At least 2 hours before going to bed, you should not use gadgets.
Chapeau, hats off for you. That's what I tell parents. Ditch the blue cut filter lenses. Ask your kid not to use a screen 2 hours before he sleeps.
Well, it's not only kids, everyone.
Let's say kids.
We are in kids discussion right now.
Because now the kids are going to blame us if they watch us.
Of course.
A lot of people, especially our countries, they think if they wear the glasses for a year, 2 years properly, completely every single day, they would expect that their vision is improving. No.
Which is also very common eye disease.
It's the second leading cause of blindness in the whole world. It's expected that 60 to 70 million people around the world have glaucoma.
It can be in any age, whoever is suffering from diabetes.
So he has to learn how to enjoy life, and then we have to restrict the screen time.
And the screen time, even the devices, they have the screen time, you can set them, but the kids are very smart nowadays.
They're
know how to turn it off.
smarter than us, yes. They could hack our own phones if they want.
Yeah. True. And there are a lot of different aspects to it. It can be something genetic, gender, which area, which region you stay in, environment plays a very big role in all kind of diseases. A lot of factors are there. We should not really blindly go into hearing someone and doing experiments with your body.
True.
Every part is precious. You don't realize unless you lose it.
Anti-reflection glasses, they do not prevent any harmful rays coming to your eye.
I was dying to hear that.
Anti-reflection, well, here it is.
Welcome to another thrilling episode of MedTalks with Dr. Anita. Today, I'm absolutely delighted to introduce an extraordinary figure in the world of ophthalmology, Dr. Ahmed Shabana. With over 15 years of impeccable service and groundbreaking contributions in eye care, Dr. Shabana has truly set a new gold standard in the field. Having trained at elite institutions across Egypt and Spain, Dr. Shabana's expertise spans continents, making him not just a leader in the UAE, but a globally recognized ophthalmologist. His experience is into few of the prestigious hospitals in Dubai. A man of many talents, Dr. Shabana is one of the few certified glaucoma specialists in UAE, treating complex cases with precision and skill that only a handful of specialists in the region can match. His expertise in vision correction surgeries is nothing short of miraculous, with thousands of successful laser surgeries that have helped people regain their sight and ultimately their quality of life. What makes Dr. Shabana even more exceptional in his passion is teaching. As a clinical lecturer, he has been shaping the future of ophthalmology by mentoring and inspiring young doctors to pursue excellence just as he has. His personal mission is to bring cutting-edge technology to the forefront of patient care, and his work with glaucoma patients, both in adults and children, truly stands out as a beacon of hope in modern medicine. In today's episode, we are privileged to tap into his wealth of knowledge as he breaks down the essential eye care practices, the wonders of refractive surgery, and the latest innovations transforming the way we see the world, literally. It's an absolute honor to have someone of his stature here with us today. Dr. Shabana, thank you so much for coming to MedTalks with Dr. Anita. I mean, that's me. Thank you so much for coming here today.
Thank you very much for having me today, and thank you for the very nice introduction.
Yeah, I literally took a lot of time to frame that because you have vast experience. So yeah, it was time consuming, but I was enjoying that.
Thank you very much.
Thanks. I understand your schedule is quite packed, and you directly on Sunday headed after a busy OPD. I really appreciate that, because this is something we are doing for the community, bringing an awareness and taking this initiative of coming out of your, the time zone and doing something is what really this profession is all about, right?
Well, it's about two things. Definitely about, what you do and what you give to the community. That's one. And two, you do know that we go way back. Me and you, we used to work previously together. So I
Absolutely.
love the podcast you're doing and everyone you're bringing on. So I had to find some time to free up myself.
Thank you so much.
Yeah.
Thank you. So, with your extensive experience in ophthalmology, you have seen a lot of different age group of patients, right, from kids and till old ages. So,
Mhm.
what is that? What are the most common cases you come across in today's time, and how you deal with those challenges?
I think the most common cases that we receive kind of varies from country to country and region to region that we practice in. So when you come to UAE, Dubai, very cosmopolitan city that we live in, we see a lot of people that have problems related to the use of screens and laptops and mobile phones because everyone is on it
Yeah.
day in, day out. A lot of allergies because you do know we live in a city that's close to the desert. That's number one. And two, air conditioners are running day in, day out, 24/7. So
Right.
a lot of people are having dust allergies, allergies from air conditions, from things they have in the environment, dry eyes from using a lot of
Oh,
screens.
allergy of like in eye as well. Strange.
Actually, there's a lot of allergies, whether acute cases or chronic cases that we see. A very common allergy we see here is dust allergy that we see with a lot of people.
So it's not only the respiratory tract; it's even the eye which gets
And
affected very
yeah, and
often.
it's even a bit worse because they're tearing, they're rubbing their eyes, they have red eyes, so it's kind of huge impact on their daily lives.
Okay, that's the most common one.
Uh,
And how do you advise like what exactly people should do to get rid of these common issues which they come across at different age groups?
So basically, when you speak about allergies, you usually have to speak about try to avoid the causative factor, the allergen, or the trigger that causes the allergy. So we can advise people that, to try to stay away from places that there's dust, if there's construction areas near them, to try to have regular cleaning of their house, of the AC ducts, which is very important
Right,
here
right.
in Dubai. That's a very common thing we need to say. And regarding the dry eyes, we could speak all day about it, how to manage dry eyes when you look at a screen all day long. I think we could, mention it in a proper way later on in our day.
Okay. So these screen issues is common in all the age groups basically because nowadays kids are also unfortunately at very younger age, at 5, 6 years of age, they are into gadgets. Even the schools, unfortunately.
Unfortunately, they're using gadgets more than us. They're using screens more than us
Yeah.
because 8 hours a day in school, they're now using, tablets and iPads. Then when they go home, they play, they study, they do their homework, they watch, videos, cartoons, everything on a screen. So they're stuck all day long on screens and gadgets, which lead to dry eyes, which previously we used to see in older age. Now we see it a lot in kids.
So let's go age by age, starting with the with pediatrics. The kids who cannot speak, what they are having like issues with related to their health. How can parents make out what is the concern with their kid related to eye health? Maybe, for example, sitting very close to the screen can be something a health issue, right? Maybe the kid is not able to see the screen well. So how can they make out certain issues happening in their kids for a checkup?
So depends again on age difference, age range. So if you speak about newborns, for example, what we usually tell moms is you have to take care if your kid is looking towards your face or not, if your kid could fixate his eye to something moving or not.
Okay.
Three, if he's tearing all the time, because tearing for some moms could think that babies are normal, they just tear, but actually it could be something very serious, like glaucoma, for instance. So
Oh,
if the
even in
kid,
kids?
even in congenital glaucoma, which they could be born
Oh,
with,
yes, yes.
if they have any white dots in the center of their eye. So these are things that usually moms have to notice in the first period of time when the babies are born. Preschool and school age, I think what you said is usually the most important thing, which is families should always notice if the kid moves too close towards the TV. Parents think this might happen because they prefer to sit closely, But usually, no. Usually, they cannot see properly from far away.
Right.
So they tend to go closer to the screen. Number two is what we call the eye squeezing. So when a kid starts to do this to see something, kind of, squeezes his eye to see something, this usually means that he's not seeing properly. Three, in schools, and that's something for the teachers that they should notice. If the kid sitting at the back of the class tends to move to try to read something on the board, or they're not following what's written on the board, they cannot read it, they're looking to their friends, looking, to see what they write.
Yes, this is very common.
Then this means that probably they cannot see properly and they need to visit an ophthalmologist.
Right. I'm surprised. It's very common. And we don't notice this. And even teachers, they don't notice. There's so many kids.
Refractive errors or myopia, which is short-sighted, is actually growing exponentially around the world. You would be shocked to know that some countries, for example, like China, short-sighted people that cannot see far distance, so myopia, which we don't know as a medical term, is almost 70%. So each 10 kids in a class, 7 of them must wear glasses at least.
Wow.
Yeah,
that's
huge
a
impact.
Big number.
Of course.
So the more advanced the cities, the more.
Yeah.
That's why I feel sometimes, when my kid at home, when he asks for an iPad, I feel I don't give him usually. I refrain giving, even if he's studying in the school. He wants to practice that at home. But I feel that we also grew up, right? I don't feel that there will be much difference if we keep them away from these gadgets. And I try to restrict it to only the school.
But a beautiful thing you're doing, but not a lot of parents do, because I actually ask all my all the parents that come to me, do you restrict the time of the screen their kids? And they usually tend to say, we try, but the kids, once you take a screen from him, you kind of find that he's a bit lost.
They get nasty.
He doesn't know what goes on. He doesn't know life, basically.
Yeah, no connection.
Yeah. So he has to learn how to enjoy life. And then we have to restrict the screen time a bit.
And the screen time, even the devices, they have the screen time. You can set them, but the kids are very smart nowadays. They know how to turn it off.
They're smarter than us, yes. They could hack our own phones if they want.
Yeah. True. Yeah. Exactly. So what is the age usually in the newborns, as you said, that parents have to make out whether the child is fixing their eye on them? So what is that age when the vision is intact in the newborn?
So to continue on your question, and that's a very important thing for the community and for the doctors and hospitals. This is something standard, I would say, in Dubai and UAE, but when you go back to our countries, we don't really have it. Any baby that is born in a hospital should have his eye checked by an ophthalmologist as soon as he's born. This is something that should be done, and it's been done here in Dubai a lot nowadays. Khalas, we have the trend of doing it, but in our countries, I doubt that any kid gets his eye checked whenever he's born. So that's something to raise awareness regarding all parents. Before you leave the hospital, just ask your OB-GYN, please, I would like to get my eyes checked for my kids. So whenever he's born, he must get his eye checked. Then at the age of 1 year, which supposedly he's now starting to see properly and he could see figures, he could know people around him, he could see colors, he could fixate, he should have another visit to the doctor.
At 1 year of age?
1 year of age.
Okay.
And then 3 years of age, that's the second step to detect if he has pre-nursery, if he has any refractive errors and needs glasses. And then at the age of 5, first year of school. Those are the set dates. Born, newborn, year 1, year 3, year 5. And then if everything is normal, every 2 to 3 years.
So these glasses, once the kids they get on glasses, is there any chances they get rid of it or they have to continue it like forever?
A very common question, that everyone asks. My kid is getting glasses. Could he remove it next year?
Yeah.
Well, very rare circumstances, yes, but majority, no. The 3 types of refractive errors that we know is myopia, short sight, hyperopia, far sight, astigmatism. Astigmatism and myopia, they don't improve. So if a kid has short sight or astigmatism and he's wearing glasses, most probably they're not going to change. Probably it's even going to get a bit worse by age.
I'm sorry, just to for our audience to know, short-sightedness, as in they can see only the close objects.
Yes, they can see close objects. They cannot see far objects.
And far-sightedness, they can see far, but not the
But not close.
Okay. And astigmatism is?
Well, astigmatism is basically their cornea is not a very regular cornea. So they kind of have shadowing and double vision whenever they see something that's a bit small in size.
Okay. So the last two cannot be corrected.
Myopia, so short sights, astigmatism, they don't improve on their own. They either stay the same or they get worse as they age. Hyperopia, which is they could see far but cannot see near, sometimes in some kids, they might improve as they age, especially during puberty time.
So how does it improve? By some treatment or any surgery? How does it work?
All right, so hyperopia, it could improve on its own when the eyeball starts to get bigger. It's called axial change. So the length of the eyeball gets bigger. Sometimes the plus numbers might improve a little bit. He might remove the glasses, he might not, but this is something we tell parents that might happen. But anyways, for all three cases, we usually wait until the age of 18, which the eye would stop changing in its shape. And then when you have stable vision, we could fix all three of them using the new laser techniques that we could, perform nowadays, like laser, PRK, LASIK, SMILE, all the new procedures we have.
We will talk about the advancements. I'm sure you're the right one to talk about all those advancements. Of course, in all the areas of, medicine, there are new technologies coming in. So people have to know about it. And you're the right one to
Thank you.
talk about it. I want to understand, this is very common myth among people that, okay, if somebody has got glasses, if they don't wear it regularly, the eye issue will not get corrected. Is it true? Like you have to regularly wear the glasses. It should be like all the time on in order to get the correction done or get rid of the glasses.
Yes. So the misconception again, and that's related to what we just said. A lot of people, especially our countries, they think if they wear the glasses for a year, 2 years properly, completely every single day, they would expect that their vision is improving. No. The glasses is barely something to make you see better. So when you have an error of 2 degrees and you put a lens in front of your eye with 2 degrees, you're basically compensating the problem you have in your eyes just to see better. If something is too small and you get, a magnifying lens to read it, this will not improve your vision. It will make you see bigger. As soon as you throw the magnifying glass, you will not see the letters, the small letters again. Same thing with glasses. You put on the glasses, you see better. You remove the glasses, you're back to 0.0. So wearing the glasses properly or not will not either improve your vision nor get it worse.
But how does the number changes when you're regularly wearing the glasses? So I've personally come across, like my mom, she regularly wears the glasses. So her number keeps on, getting lower and lower. Like she gets better in her vision, but not for my dad, like because he doesn't wear regularly. Does that really happen?
Again, it's not related to using the glasses. It's relating to change in the axial length and the lens of the eye.
Okay.
When this happens, it could change the refractive index of the eye a little bit, but it's not related to wearing the glasses at all.
Okay, got it. Yeah. What about the kids who cannot refrain? For example, now if it's compulsory in the school, it's compulsory. I mean, if you have to come back home and practice something, you have to do it. Otherwise, you're way behind other kids. So if you're using the screen like iPads, or if you're the gadgets basically, what are the ways where you can protect the eye health of a kid? Is there any?
Yeah. Well, number one is distance. We usually tell all parents that you have to notice that there is a proper working distance for all of us for screens. So it should be at least 60 centimeters.
60 centimeters.
Yeah. So do not make your kids hold the iPad, hold the phone, sit right, very close to the screen and think that this is good. No, we have to relax his muscles. So we have to have it at a proper distance so that he could read properly. So that's number one, distance. Number two is extended screen use. So we have to know that they have to have proper spacing of time when they're using gadgets. So they have to take frequent breaks. So they would sit for 20 minutes, 30 minutes, and then give them a break for a minute or two. 20 minutes, 30 minutes, and then give him a break for a minute or two. There's a very interesting note. You do know that Americans, people in the US, they measure vision by 20. So they tell you 20/20 vision. Mm-hmm. So they have a very interesting sentence. They tell you that for good health of your eye, especially in front of screens, every 20 minutes, take a break for 20 seconds and look at any object at 20 feet away.
Wow.
Yeah, to try to make it easier for people.
Every time I get mesmerized by some of the rule, 20-20 rule. Last time I had a podcast, it was a 30-30-30 rule. So this is something new for
it's
me.
a 20-20-20 rule.
Okay.
So to have 20-20 vision, you have to take a break every 20 minutes for 20 seconds to look at a target 20 feet away. The figures itself, they're not something we have to abide to, but it's a rough figure to tell you that you have to take frequent breaks to look far away, to make your eyelids start to blink, to make your tears come out, to make your ciliary muscles try to relax. So apply it on yourself, on me, on your kids, frequent breaks in front of screens to let your eyes feel better.
Does this blue filter, the different kind of filters available in gadgets to compensate that, you can use the screen as much as time possible, does that really work? These filters.
Lovely question. So there's a myth that even we ourselves fell in at some point where people would sell you anti-reflection coating on glasses to protect you from screens. And then later on, recently, they would start to sell you the blue filter glasses or lenses to protect you from the screen. Well, let's break the myth once and for all. Anti-reflection glasses, they do not prevent any harmful rays coming to your eye.
I was dying to hear that.
Anti-reflection, well, here it is. Anti-reflection lenses improves the flow of light breaking on the surface of your glasses, so you would see a more crisp picture. Right? That's one. Number two, the bigger myth nowadays. Any optical shop, any mall you go to, you're going to be surrounded by people telling you, if you're using a PC or a laptop or an iPad, please buy the blue filter glasses. Well, let's explain just basic things. So there is a wavelength of light called the blue light, which is something we don't see. So it's not the proper blue people think about. It's a wavelight that we don't see. This comes from the sun. And when it hits the eye, it starts to cause an activation in the cells of the retina at the back of the eye to make you feel that it's morning time. So it activates your biological hour time. How do we confirm that? Remember when we were kids and your parents would go in the room, if they want you to wake up, what did they do? They would
open the
curtains. And as soon as they do so, you wake up and you cannot sleep again. Why? Because you got activation of your biological hour that it's daytime. Screens also emit the same blue wavelight coming from the sun, but of course with a very less impact.
Less intensity.
So what happens is, when you use a laptop or a PC or an iPad or a phone, especially at night for a long time, you would notice that sometimes you feel a bit sleepy, you go to bed, you hold your iPad or your phone, and then one video leads to another one and you stay awake for an hour or two.
Yeah, right.
Why? Because the emission of this blue wavelength comes into your eye, so it starts to make you feel it's daytime.
It's daytime.
So you start to feel a bit awakened. So what happens is you go to sleep, you wake up really drained and you don't feel that, you're feeling healthy and awake. Why? Because you drained all your body thinking it was daytime. So the blue filter is actually very good for people that use screen before they sleep or at nighttime. But do they protect from something that would damage your eyes? Absolutely not.
Wow, good to hear that. So this is the reason people advise that, at least 2 hours before going to bed, you should not use gadgets.
Chapeau, hats off for you. That's what I tell parents. Ditch the blue cut filter lenses. Ask your kid not to use a screen 2 hours before he sleeps.
Well, it's not only kids, everyone.
Let's say kids.
We are in kids discussion right now.
Because now the kids are going to blame us if they watch us.
Of course. Any other common concern related to kids' health you think we should cover here if we missed out, and which is very common nowadays and you would like to address?
Again, things that we tell to parents of kids. If you notice that your kid is stumbling over things, if he's hitting things, don't just say, my son is a bit clumsy, that's all. No, get his eyes checked, because a lot of the times he's not seeing properly. When he's not seeing properly, he starts to trip over things at home. So it could be an indication that he's not seeing properly. Number two, if he starts to squint, so if your kid starts to deviate his eyes inwards or outwards, he starts to squint.
Squinting, yes.
Yes. Squints could mean that either he has a problem with his vision and he needs glasses, or a problem with his eye muscles and he might need surgery. So this is something that also we have to address as soon as you notice it. A lot of mothers would come and say, my son has squinting eyes, but I asked someone and they told me
it will get better on its own.
It will get better on its own.
Yes, the most common myth.
Yeah. Usually it doesn't. Yeah.
We are breaking big myths today.
Yep.
Yeah. So it requires surgery or it gets better on its own, the squint?
Well, it depends on the cause. If it's something called accommodative squint, which is due to an error of refraction, so the kid cannot see closely very nice. So what he does, he starts to squint his eyes to try to read properly.
Okay.
So that's squint because he needs glasses. Sometimes it's due to a weak muscle or a weak nerve denervation, and this needs surgery. So based on the cause, we could treat the case either with, glasses, patching the eye, or with surgery.
Right. So these are the common ways to correct. Okay, the glaucoma, the optic nerve issue, which results in the pressure changes in eye, it can be in any age.
Yeah, true.
Right.
Glaucoma could be 3 stages, either congenital, so a baby is born with it, or juvenile, which means comes to younger kids, or adult glaucoma, which usually comes 40 and above.
Which is also very common eye disease.
It's the second leading cause of blindness in the whole world. It's expected that 60 to 70 million people around the world have glaucoma. Unfortunately, 50%, so more than 30 million, are not even diagnosed. So yeah, pretty common disease, and impact is very high.
So what is the one sign, or maybe few signs which people should keep in mind that this might be an early sign of glaucoma?
All right, so it's pretty easier when it's congenital than adults. So if we speak about congenital glaucoma, so a baby is born with very high pressure in his eye.
I'm sorry, before that, can we explain a little bit about glaucoma? What is it exactly?
Yeah. So basically, glaucoma is damage to our optic nerve due to elevated pressure inside the eye. And the most common question is it related to blood pressure? No, it's not. So my pressure in my body is not related to the pressure in the eye. It's damage to the nerve of the eye that would cause loss of vision due to elevated pressure inside the eye. Yeah. And as we said, congenital, juvenile, adults. So newborns, young age, old age. Newborns is usually the easiest to pick up because when the pressure goes up, the eyeball, when a baby is stillborn, has the ability to expand. So pressure is high, the eye would expand. Pressure is high, the eyes would expand. So something called ophthalmos would happen, which means the mother would come and say, something is wrong. My baby's eye is much bigger than usual.
Bulging.
Yes. And would start to have something called a blue hue. So a bluish discoloration of the eye would start to happen, tearing and photosensitivity. So the kid, tearing a lot, cannot open his eye in the sun, and bulging a little bit, and bluish discoloration. Those are the most common symptoms and very easy to pick up by the mother.
In kids?
In newborns. Unfortunately, for adults, it's the other way around. If even, we usually tell people it was used to be called the silent thief of vision. Why? Because it has no symptoms. So when the pressure starts to increase inside my eye, nothing happens. I don't feel anything. Unless it's extremely high, I would get, pain in my head, headaches, pain in my eye. I would start to see something like rainbows, but that's with very high pressures. But, the 20, 30 pressures, which most people with glaucoma have, they don't have any symptoms until almost 50% of the nerve is damaged.
And the complication is?
Unfortunately, whatever axons or, parts of the nerve that is lost could never regenerate. And each part of the nerve lost would result in loss in a part of my visual field. And glaucoma is even a very tricky disease because it causes loss of my peripheral field of vision. And that's why we never notice it. Because usually a person human beings are different from other creatures. Other creatures rely on peripheral
All the
vision.
others, yes.
Yep. We rely on central vision. So when you lose a certain part on the outside part of your vision, you never really notice it. You only start to notice when you start to walk and bump into people beside you. And when that happens, usually 50% of your nerve is lost. And whatever is lost from the nerves, we cannot regenerate till today.
So if early detection is the best thing.
Is the clue
because
to
there's
glaucoma.
no cure.
Because there's no cure till date. And that's why I told you it's one of the leading causes of blindness in the whole world.
Coming to diabetic retinopathy, it's again very common. So any age, if somebody is, because diabetes is now, even at early age, people get diabetes. So younger adults are also prone to get diabetic retinopathy, or it's only the old age people who get this disease? And what it is, to explain our audience just a bit, and one or
Okay,
two lines.
so to explain in a very simple way, I usually tell people our body just works like this city we live in. To have a healthy home, you have to have a proper pipelines that provide water to your home so you could live.
Right.
Same thing in our bodies. To have healthy tissues, healthy organs, we must have pipelines, which in our case is blood vessels. So blood would travel through it to different organs so it could work properly. Right. What if the pipelines in this city, you put a very irritating chemical with very high flow inside the pipelines? What would happen is damage to the wall of the pipelines. And when your pipe is damaged in the wall, leakage would start to happen.
Leakage will happen, right.
Same thing happens in our body. When the blood vessels have a lot of sugar going through it, the wall would start to have damage. And when it's damaged, leakage would start to happen.
Okay.
When leakage starts to happen in different parts of the body, it starts to cause damage. That's what happens in the eye. The back part of our eyes, called the retina, has a lot of very small blood vessels. When those are damaged, leakage happens. When leakage happens, we don't see properly. That's basically diabetic retinopathy in an easy way for people to understand.
And it can be in any age, whoever is suffering from diabetes.
Yes, it's related to two risk factors. One, uncontrolled diabetes. Two, the duration of diabetes. So if I have diabetes for like 5-7 years, but it's totally uncontrolled, I might expect diabetic retinopathy. If I have diabetes controlled, but for like 15, 20, 25 years, I might also expect diabetic retinopathy. So it doesn't matter of the age, it matters how well you control your diabetes and how many years you've been having it.
So even if you control your sugars, you can still land into diabetic
You could still
retinopathy.
land into diabetic, of course, a much lower risk, but you might land into diabetic retinopathy, especially after very long time. And this is why we tell people with type 1 diabetes, which is the diabetes that comes to younger people, that they have to be very meticulous because, they're going to live 30, 40, 50, 70 years with their diabetes. So they have very high risk of damage. If they don't control the diabetes, it's going to be much worse.
What are the advancements in medicine to treat diabetic retinopathy?
All right, so we had actually a lot of advancements. One, proper ways to manage diabetes is one thing. Probably you do know this more than me, about the lifestyles, about the new medications for diabetes, about the new injections
Why
for
did
diabetes.
you guess that I know more than
Because because one of the things is ophthalmologists are really into
The
the
eye.
eye only. We're kind of dentists, We know only one thing.
I agree.
So,
I agree with you.
Yeah.
Now I know.
so
Yeah.
when we speak about diabetes, there's a lot of medications over there in the all over the world with the new injections that help people to lose weight, control diabetes. So all this is one advancement. And then when you have diabetic retinopathy, now we have a lot of advancements in what we call anti-VEGFs, anti-vasoendothelial growth factor injections. And those are injections that we inject inside the eye to clear out all the leakage, or what the medical term is edema, inside the retina. Very, very potent. Results are pretty fast. And, it's a very quick procedure. It takes a minute or two. You just take an injection. Usually we start taking one injection every month for 3 to 5 months. And then you start to have regular injections every like 2 to 3 months over the next years.
It's safe?
Extremely safe, and if done in a proper place that has, no risk of infection. But yeah, very, very safe procedure.
And can be done at on a day basis or it?
Some countries, even in the UK, for example, they even do it inside the clinic without any admission for the case. Patient would come in the clinic, take the shot and just leave. Here in Dubai, we do it as an OP procedure. So a patient would come, but we take him into a clean room, do a proper injection under sterile conditions, and he leaves after 5 minutes. So it's a procedure that takes an hour, inside the hospital.
And how much is the duration of getting rid of this disease if you go through these injections?
It differs from one person to another. We cannot really say for each patient how many injections, but around figures 5 injections to get a very good response where you clear the edema from all the eye, and then you decide later on what you're going to do next.
Okay. What is the most common symptom or sign people should notice that this might be a sign of diabetic retinopathy, because diabetes is very common nowadays and people might ignore?
Yes. Well, unfortunately, again, just like glaucoma, which we spoke about, diabetic retinopathy is the same thing. It does not really have any signs unless the edema is a lot and it starts to have blurred vision. But the only thing that patients should note is that if they have diabetes and they start to notice that they have foggy or blurred central vision. So when they look into your face, they can see everything a bit clear, but your face is a bit blurred. This might indicate that there's leakage in the central part of the retina called the macula, which could indicate diabetic retinopathy.
Okay. And how often you advise people should get their eye checkup done if they're suffering from diabetes?
Every 12 months. Every year is a crucial indication to do for those patients, so that we could pick up any very early diabetic retinopathy, which we could manage with the endocrinologist, with medical treatment, even without injections. If there is diabetic retinopathy, sometimes we could even see the patient a bit earlier, like every 6 months or even sometimes every 3 months.
People usually ignore this because when they go for an annual health checkup, it's mostly the kidney issues, the liver issues, the gastric issues, the lung, and that's all. Eye health is mostly ignored.
Yeah. And I think, that's one of the things why your podcast is being seen a lot, because you're highlighting things that a lot of people seem to miss or not understand properly.
With the experts.
We try to do our best.
Thank you so much. Dr. Shabana, I think I missed out one topic of amblyopia, which is very common again in kids, right? Can we highlight a bit on that?
Yeah, well, the word is amblyopia, and a lot of parents don't understand it, but it's basically reflects or means something called lazy eye.
Lazy eye.
So What does that mean? To just, again, simplify things. The eye itself does not see. The eye is basically a camera. So we have 2 cameras that captures pictures, and those pictures are sent to the brain, where the brain would put both pictures together and he would see the proper picture. What if one camera has a very clear picture, one camera has a very blurred picture? Both pictures would go up to the brain. When the brain tries to fuse the picture together, he finds that there's something wrong. So what the brain decides to do is he would start to cancel out the blurred picture he gets from the weak eye and starts to focus with the picture that comes from the good eye.
Better eye. Right?
Yes. And with time, he would get more impulses from here and reduce the impulses he gets from here. And that's what we call lazy eye. So he's focusing on the better picture and refusing the worst picture. And if we leave it for a long time, what happens is you bring the baby or the child, we try to fix it. So we put the glasses to fix the weak eye, but you get shocked that you find that the eye does not improve. It does not see any better. Why? Because the brain is refusing to use this eye anymore. And that's why we call it the lazy eye.
Okay. I mean, it's very difficult to diagnose, right?
It is usually, it's not difficult to diagnose, but it's difficult to get the child on time if the parents are not bringing him for regular checkups. Because a lot of the times, the child could see properly with one eye, so he does not really do the things that we mentioned before. He does not squeeze his eyes to try to see.
Because the body is adjusting
Yes.
itself.
He
So
does
you
not
cannot
go
make it out
closely
really.
to the TV. He does not change his place in the
Right,
class.
right.
No, he's a normal kid. So the parents, they don't bring him to the ophthalmologist, so they never notice that he has a lazy eye. And the problem with lazy eye is the more time you spend without trying to correct it, the harder it is to correct it.
But it's correctable. It can be corrected.
It can be corrected, especially under the age of 12 years old. So if you bring the kid below 12, we have a very high probability of correcting him. Above 12 years old, it's not always as easy to correct.
So I think you must be coming across usually in the regular eye checkup. Otherwise, it's very difficult, right?
Of course. And
Or
again,
otherwise, what is the symptom? Usually?
no symptoms whatsoever. Sometimes if the lazy eye is extreme, the boy would start or the girl would start to have a squint in their eye. And that's when the parents would bring him. But again, if you go to countries like, where I came from, which is Egypt, we don't have, the thoughts of having a normal checkup for kids every year. We used to see a lot of amblyopia kids and lazy eye kids. When you go to countries a bit more advanced, so let's say Dubai, very good healthcare insurance, you would see kids with much less amblyopia because usually families would bring their kids for regular checkups
checkup.
every couple of years.
What is macular degeneration, Dr. Shabana? It's very common as well, right? Usually it happens in old ages or any age it can happen. And what is it exactly?
So from the name you just said, macular degeneration is basically the macula, which is the central part of the retina, which is responsible for seeing the most crisp and most focused picture right in front of me, starts to degenerate or starts to get damaged.
Okay.
A lot of causes, a lot of diseases go under the umbrella of macular degeneration, but the most common and that what everyone knows is what is called AMD or age-related macular degeneration. A very common disease that we see, especially in Western communities, that usually comes with age. So yes, age has an extremely important factor in macular degeneration.
It comes with age.
Yeah.
And what other treatments, any advancements has been done in, to get rid of this disease?
So unfortunately, till today, there is no definitive treatment for it, but we have a lot of advancement. Just like what we said, there's a lot of injections for the diabetic retinopathy. We have also anti-VEGF injections for AMD, age-related macular degeneration, which kind of helps, prevent the quick loss of vision. But it does not really treat the cases. But the good news is, nowadays, there's two very important materials people are looking into. A lot of research are being done on them, which is stem cells and gene therapy.
Oh, it works in ophthal as well? Wow.
A
Tell
lot.
me more about it, please.
A lot. And that's, that it's going to be groundbreaking because a lot of problems in the retina and in the macula is unfixable. If you look at anyone that has advanced macular degeneration, if you look at anyone that has optic atrophy, you find a person, very healthy person, cannot see properly, cannot live properly, and we can't find anything to do for him. For cases of progressive macular degeneration, we just sit and watch him lose the rest of his vision as we speak.
And
And we
it's mostly genetic, right? I'm sorry, I'm interrupting.
it has a genetic predisposition and age, as we mentioned, and a very crucial thing we have to mention: smoking. It has a very essential role. It's a very, very active risk factor for macular degeneration. So all those could lead to loss of vision. Before we used to just sit and watch those people lose their vision. Now we could kind of stretch the loss by the use of injections. But what's groundbreaking is the advancement we have right now, especially for gene therapy and for stem cell therapy. We're going to see very, very soon, very promising. And most of our new conferences usually have sessions dedicated to gene therapy and stem cell therapy.
So advancements are happening in that region.
100%.
So Dr. Shabana, other than smoking, what are the other lifestyle habits, I can say, regular habits, which can affect eye health?
Okay. So as you mentioned, smoking is one of the worst things that happens that you could do towards your eyes. It affects the dry eyes, gets your eyes dry, causes allergies, gets you cataracts, risk factor for macular degenerations. Everything is related to smoking. So smoking is one of the worst things.
Vaping? I'm sorry. Let's cover
Yes.
that.
Same thing.
People think
I-
vaping is safe.
I just had actually today a patient with macular degeneration, old patient, and I told them you have to stop smoking. It's very bad for your health and for the macular degeneration. So he told me, well, yeah, my doctor told me so, and I have stopped after 28 years of smoking. I told him, wow, good for you, but your cough, seems a bit odd. He told me, yeah, but the new vape I'm using right now is not, very good to my chest. So yeah, people think that vaping is different than smoking. It might be better, it might be worse. We're not really sure, but it has a lot of the same effects on your body.
So we covered smoking.
Yeah, so smoking,
I'm sorry I took you in that direction because it's a very common myth. People think vaping is safe and it's getting increasing because you can still be among people and vape. So it makes you more comfortable doing that.
Exactly.
Convenient.
Yeah.
So smoking.
So smoking, 2, hydration, which is drinking water. Again and again, we're seeing more people tend to, with the busy life nowadays, tend to forget to hydrate themselves. People tend to forget that almost all our body is made of water. All of the planet we live in is made of water. So not getting ourselves hydrated properly, you're actually cutting on 70% of your body, which is made of water. So hydration is very important, at least for your eyes to maintain a healthy, non-dry eye. 3, UV exposure. And that's something very important for people that live in Dubai, people that come from North Africa like myself, people that come from Eastern Asia like yourself, people that we have a lot of sun. Exposure to sun is good, but exposure to a lot of UV light is very bad. And usually when someone comes and tells me, can you tell me one advice that's crucial to your eye? I would usually tell them that you have to use UV protection sunglasses every day. So using sunglasses that have good UV protection, 100% UV protection, is very important for every single person that walks in the sun, drives in the sun, goes to the beach, goes to the pool.
You have to have it on. What is a way to make it out that this is a good glass with the UV protection, proper UV protection? Is there any way?
So unfortunately, you cannot really tell. But one of the things is buying from a good, trusted source. That's number 1. Number 2, when you look at the side of the lens of sunglasses, you would either read 100% UV protection, or you're going to see the number 400, which is, the amount of UV protection that we need.
400?
Yeah.
It's written on the glass?
Yes, on the side of the sunglasses, usually.
Okay. So it's like for all the age groups? Or specific age group? Otherwise, my son will, after seeing this podcast, my son will start asking me, I need those glasses.
For all the age groups, but again, it's a bit hard to tell a child to start using sunglasses anytime he goes out and play. But I usually tell parents, for the younger kids, if you're going to the beach, to the pool, they're going to play, in a play area with a lot of sun, just put a hat or something that would prevent direct UV to their eyes.
How common is cataract, Dr. Shabana, and at what age group?
How common is cataract?
And what is cataract for our audience?
Okay, so let's go say what's cataract first. The lens, we have a lens inside our eye. This lens is basically a crystal clear lens present inside the eye that has a power to see. Just like when I started to age, I started to have, white hair.
You still look smart.
But smart, but aging. So same thing happens to the eye. As we start to age, the lens would start to change color from a crystal clear color to a more whitish color. And that's why in Arabic, by the way, it's called maya beda or white cataract. Because the lens would start to change from a crystal clear lens to a whitish lens. So I would start to see a foggy, cloudy vision. So how common is it? It's 100% common for the whole population in the whole world if they live long enough.
Long enough as in how long?
All right. So it usually starts, your lens would start to change the color somewhere over 50, 55 years old.
Okay.
But the rate of progression that happens could take 5, 10, 20, 25, 30 years. So anytime between the age of 55 to probably 80, 85, everyone's going to have cataracts. So, if we live long enough, then probably every single person around the world will have cataracts at one point.
After our podcast, I think people will live at least a bit of, years long enough by awareness. I hope so.
Yeah, hopefully.
Hope so. Yeah, we are on the mission.
Yeah.
What about the advancements in procedures? I mean, the technology for getting the treatment of cataract done, Dr. Shabana?
It's actually very, very advanced right now. So if we remember when I first graduated, 20 years ago or something, at that time, most of the cases were being done surgically. So we would have to open kind of half the cornea just to go inside and catch the lens and put it out in one piece. Surgical procedure that has sutures and stitching. The recovery is a bit long. First, we were using something called a hard lens. So we had to put a glass lens inside the eye. It was kind of a big procedure. Now, we have extremely advanced machineries which do something called phacoemulsification, or what we call it in short, phaco. So it's basically using ultrasonic waves, very high frequency, to emulsify all the proteins inside the lens so they disappear. And we do this through an incision that's usually around 1.8 millimeters. So it's less than 20% of 1 centimeter. It's a very microscopic procedure. And we use something called a foldable lens. So it's something that looks like the contact lenses which people use. And we roll it over each other. And then we just push it through the same incision to go inside your eye. So what happens is we remove your cataracts. We put a lens to fix your vision. So you don't need glasses even after the procedure. You can see far and near without glasses. And this very small wound would usually close on its own within a day or two.
Within a day or two.
So the recovery is usually 24 hours and the patient could go back to his work. He could drive. He could do whatever he wants.
What about those glasses? People refrain from getting the cataract surgery also because they have to wear those black glasses, like completely black. And how long they have to wear that?
Usually, I give my patients those glasses only for one day. And then the next day I would tell them to use sunglasses that they own only when they're in the sunlight, but they could drive, go back to work, do whatever they want. The procedure is really quick. People that have a bit of experience in doing cataract surgeries, we do the procedure in usually less than 10 minutes. So it's probably a 7 to 8 minute procedure. Some people even do it faster than that. But let's say 15 minutes or less, and you're done with your cataracts and you could see properly. So quick fix, day case procedure. You come, you do it, you go back home. Next day, you're good as new.
You can do both the eyes together. It's advisable to do one at a time because usually it affects both eyes, right? And doctors advise get both the eyes done. So
yes, well, usually it's gonna come in both the eyes, and we do both eyes. Do we do them both together in the same day or not? That's a very debatable question in our practice. Most people don't.
For example, if anything went wrong, it's only the one
Yes.
eye.
Yes. So most people would go with the school of doing one eye, waiting a couple of days a week, couple of weeks, and then do the second eye. But some schools in some countries, they would do both on the same day, and they would tell you it cuts the costs, it's easier for the patient, it's easier for you. So they would do both together. But my personal preference is
One at a time.
Yeah, 1 week apart.
1 week apart.
Yeah.
Any ways we can prevent cataract, or it's not preventable? You cannot prevent it by any kind of lifestyle changes, any modifications, anything?
Well,
it's very common since you said like 100%, everybody will get
it's
it.
going to come either way. But we have found some risk factors which could, if we don't get exposed to the risk factors, we could kind of reduce the probability of getting it early on. One, UV exposure. So just like what we mentioned, if you put on sunglasses with good UV protection, you might protect yourself from earlier cataracts. Two, smoking. If you quit smoking, you might also prevent this. Three, steroids. A lot of the times, the cause of earlier cataracts is using steroids, for joint pains, for asthma, for whatever it is, for using drops for allergies. So try to refrain yourself from using a lot of corticosteroids medications. Those are probably the three things that we should try to prevent. What things could help? Well, we've been seeing that a lot of the main cause is oxidative stress that happens on the lens. So using antioxidants on daily basis could kind of prevent, or not prevent, if we may say, could kind of make it a bit late to get your
Slow down the process.
slower the process a little bit.
They're in different. I'm not against any pathy or any kind of a practice, but many people tend to get into natural way of getting rid of cataract, and they do so many things with the eye. They put, alum, the alum water.
Yeah.
They make some juices and they put it in the eyes. So all these things, do they really work? Does it make sense? Or hearing from the
Yeah,
expert? Again, not against any pathy for sure.
No, but we're not against anything, but we as physicians, we believe in evidence-based medicine. So if you could prove through proper cohort studies, head-to-head studies, that you're actually preventing, delaying your cataracts, I would believe you and I would follow you. But if we would claim that I think it worked better, this does not qualify as evidence-based medicine.
Doesn't go.
If you would say that, well, we have tried it on 2 or 3 or 5 or 10 and they did not get their cataracts yet. Well, you don't know if this homeopathy or whatever you're doing, pathy, is the thing that worked, or they just did not get their cataracts because it's not meant to be yet. So I cannot really tell people to do something that I don't have proper evidence on.
And there are a lot of different aspects to it. It can be something genetic, gender, which area, which region you stay in, your environment plays a very big role in all kind of diseases. So a lot of factors are there. We should not really blindly go into hearing someone and doing experiments with your body.
True.
Every part is precious. You don't realize unless you lose it. And you have to.
If you do see the amount of patients and the amount of things we hear, you would be amazed of what people could do and could believe in just to try to avoid surgery. I've seen all sorts of things. I've seen people, putting honey in their eyes every day to try to prevent cataracts. I've seen, at one point, people using camel urine.
Whoa!
Yeah, it was a pretty trending, thing at one point of time for different, diseases, to use either camel milk or camel urine to treat different diseases. So, yeah.
So, Dr. Shabana, there's a lot of advancements in surgery techniques. Basically, this LASIK surgery is very much in common. How does it really help to get rid of any kind of refractive errors or, vision defects?
Well, if you look at the trend of laser and LASIK surgeries, it started probably in 1989 or 1990, where at that time they were doing the laser, where they would basically kind of burn, the cornea and the superficial layers, and people would stay in a closed dark room for 3 to 4 days, tearing and crying and shouting, having red eyes, but their vision was improving. And then we saw some people that were doing something called RK, radial keratotomies, where they would use a blade to do cuts in the cornea. And then when the cornea heals, vision would improve. So when you look at this, and now you look at the advancement we have nowadays, this was torture at one point.
Yeah, this is the reason probably people refrain from getting into surgeries. They don't know what advancements have been there.
Exactly.
Yeah.
What people don't know that now there is very recent advancements that the procedure with very new machines could actually take 8 seconds. There's a very new procedure called Smile Pro, for example. It's the newest trend in LASIK. It's an 8-second procedure per eye. So the whole procedure would take, 16 to 20 seconds. It's as easy as that. And it's as safe as next day you could rub your eye if you want.
So this is to get rid of the glasses?
You could put makeup, yes. And you get rid of the glasses for the rest of your life. So there's a huge, huge, huge advancement that happened in the area of laser vision correction to remove the glasses. One more thing. Before, if someone was, my age, above 40s, they would usually tell him, oh, we're very sorry. We don't do LASIK for people over 40 years old because you're using reading glasses. Well, now we have presbyopic correction, which means we could correct the presbyopia or the problem that happens after the age of 40. So we can do LASIK, even to make people lose the glasses for far, for near. They could lose it for the rest of their lives. So there's a huge impact where we could probably treat any kind of person that uses glasses.
And they will be rid of glasses forever. Because there's also
Yes.
one myth that, if you get the LASIK surgery
After a
done,
couple of
after a
years,
couple,
yeah.
again, you will get back the same. So again and again, you have to do the surgery. It's not that.
A very small, population percentage of people could need a touch-up or an enhancement after a couple of years. But the majority of people now, with the most recent machineries that we have, are usually guaranteed to have, perfect vision until, they grow older.
Okay, we had a very fruitful discussion. As a takeaway, what would be your advice, Dr. Shabana, as an expert, to all age groups? Like these are the tips and tricks to keep your eye healthy.
All right, so 3 tips. 1, we already mentioned it mid talk, which is UV. Protect yourself from UV light. Use proper sunglasses that have UV protection. Put on cap, a hat, whatever it is for you or for your kids, whenever you're on the beach, on the swimming pool, any place that has a lot of sun, especially our countries. That's number 1. Number 2, smoking and vaping.
Yes, thank you for that.
Both in the same bucket.
Yeah.
Kindly refrain from, smoking and vaping. Year after year, we've been seeing that a lot of problems are happening with the same risk factor, which is smoking. So please, if you want to have proper advice, is stop smoking. And number 3 would be eating green foods. Might, seem also a bit trendy for people, green. Again, can I just...
Yeah, sure.
Okay.
Yeah.
Number 3, eating green food. Very important. We've been finding a lot of evidence, a lot of studies on antioxidants, on materials present in the greeny leaves, like spinach, like kale, like a lot of things that help the eye. Help with dry eyes, help against oxidation, antioxidants as in cataract, macular degeneration. So 3 tips: sunglasses for UV protection, stop smoking, eat green.
For antioxidants. People like to get things easier. They don't want to chew a lot of vegetables. Usually it's green leafy vegetables, right? They tend to take capsule. Capsule is more easier, no? To go to the pharmacy and take an antioxidant rather than
it's a lot easier,
having
but
it a natural way.
But I usually tell people natural way is always better. And now, again, there's a huge trend for green smoothies. Instead of eating green leaves, just put it in a blender and have a green smoothie.
Perfect. Thank you so much for coming today on MedTalks by Dr. Anita. It was a pleasure having you, Dr. Shabana. Thank you so much.
Thank you very much.
Thank you.
Thank you.